day 3 after we landed, my dad wasn't feeling well. When we were, running around, my dad just wasn't feeling well. He decided to stay home. So my mom and I had gone out to go run some errands and such. And when we came back, walked into the house, and my dad was in bed covered in blood. We had left him that morning just because he wasn't feeling well. We're like, yeah, okay, we'll come check on you after lunch. Came home. He was still in bed, but he was not the same in bed as when we left. So,
Oh my God.
yeah, so he's covered in blood. As soon as I saw him, I mean, he did open his eyes, thank God. He had fallen. He wasn't feeling well. He went to the bathroom. He was coming back and he lost consciousness and fell and hit his face on the way down. So he broke his cheekbone, he broke his nose, he broke his orbital socket. He broke 3 of his ribs. So like a serious fall. We're really super duper lucky that he didn't break hip, but yeah, so then the first encounter with the German system came into play. We dialed the emergency number, which in Germany was 112.
Okay.
And within 25 minutes, an ambulance had come.
Is medical care so much cheaper abroad than in the United States? You've probably heard that medical care in Europe or in Asia is a fraction of what you have to pay here. And it's universal healthcare versus in the United States, it's just not. And it's expensive. So why is that? And should you move abroad for cheaper medical care?
Other countries are smart to realize that, health care is more important to a human than monetization. Period.
Then like profit. Yeah. So
Profit,
our
exactly.
healthcare system is a for-profit system.
It's for-profit
system.
Whereas I am a living proof, because I recently just had surgery, to say they care more about a person and their health to get healthier than, and people rather pay a lot more taxes to ensure that they were going to get the benefits that they're going to get.
That's the key. People here do not want to pay, because in some cases, depending on your income, I mean, I think it's like bracketed, but if you could get 25% taxed or 40% tax or more.
In the States, yeah.
Right. No, in Europe.
Oh, yeah. It is based on your...
It's like a flat rate based on your...
Right, yes.
Based on how much money you make a year.
Yeah,
and most of the time, and somebody's going to probably correct me, but I've heard from other colleagues of mine where they have said, oh yeah, I don't want to go into a higher tax bracket.
Right. No, in fact, because I was talking about this with Guillaume, my French tutor, just the other day, and he said that the very, very rich in France prefer to move to the United States because it's cheaper.
Exactly.
I was like, what now?
This is true.
Yeah.
Whereas the if you were in a lower tax bracket, this is obviously a dreamland for people when it comes to healthcare or just tax in general, or obviously it's the same as in the States, getting married and all this other stuff. But it is interesting. And yes, we do pay a lot here in taxes, but no one seemed to bitch about it like in the States or something like this, because you know what? We still get taxed in the States, right? And you still pay a shitload of money.
Yeah, you still do. Now, here's the other question, though, to that. I think if we ask that question, what is the type of care or the level of care that you can expect for that universal or socialized? I'm going to say socialized medicine, because there's somebody that's going to be in the comments that's going to talk about that socialism. So we have to address that.
Well, they can say whatever they want to say because it's ignorant.
Well, of course, and we know that, and we've gone toe to toe with that, but. What type of care? What's the level of care that you get?
Like the quality. Yeah.
The quality.
I've had personally surgery in 2 different countries, Germany and France. And both times I've had it, top notch. And I even put out a video documenting my experience, especially when I was here in France. For instance, you have an option to have public or private. And anywhere out you go, the bottom line is, if you can afford it, you probably could even pay for it out of your own pocket. Whereas quick example, I just had shoulder surgery. And I looked at what the cost would have been in the States. It would have cost me an upwards of $50,000 for my major shoulder surgery that I had.
Without any insurance, it's 50 grand.
Without any insurance,
Okay.
if I was to do it in America, it would have cost well over 50 grand. That
Okay.
same exact service I have in France literally cost me less than $1,500 for the whole thing. And that was including a
wild.
private room, including chef type meal. And when I tell you the hospital food was damn on point.
So was it like green
It was,
jello?
it was everything. It was like,
So wait, was that with the insurance or without your insurance? Because you
that's
have
what I mean. So
additional
with the insurance,
Yeah.
so with the insurance, and my secondary insurance, which is my private insurance, the cost that I had to literally physically pay out of pocket was, I think it was something like $1,200 or something,
Wow.
euros or
Yeah.
something. However, when I paid that out of pocket, I get a receipt. I then send that receipt to the government and to my secondary insurance. And guess what? I get fully reimbursed almost for everything. So about 96% of everything of that $1,200 back into my pocket.
And how much is the secondary insurance that you're paying?
So it depends. If you
Okay.
are, the best ones you get is usually with your company. And if you wanted to do one where you want full coverage itself, you will pay probably at premium $200 a month.
Okay.
That's still cheaper than what we pay here.
Exactly,
I mean, you'll pay $200 a pay
you're going to
period
pay over
just for-
$1,000.
And a pay period being every 2 weeks. Some
Yeah.
some people get paid weekly. So yeah, that's still
And that's the
ridiculously
secondary
cheaper.
insurance, not the primary, because the primary
No,
is
the primary
just
is the government.
everyone gets.
So
yeah.
the government's
Yes.
insurance.
Okay.
Yeah. Wow.
Yeah.
That's amazing.
Which is
So and so I guess like they and is it because it's socialized medicine that they were doing all these very expensive procedures?
Yeah.
Okay.
Yeah,
Yeah.
because so day one, like once he was actually admitted to the hospital, I got a call from the administration and they were like, "Do you speak German?" And I was like, "Yes, I do." They were like, "Oh,
Thank
good."
God.
But otherwise, they were going to have a translator there. They were going to have somebody there to be able to talk to me and explain what was happening. But they basically wanted to understand our insurance situation because they were like, "Do you have private insurance? Do you have traveler's insurance? Do you have what kind of insurance do you have?" to figure out how they needed to handle it. So now, so word to the wise, which anytime you travel, get traveler's insurance. It just makes everything that much easier. In this case, I could slap myself because my parents were like, "We have TRICARE."
Yes.
I was like,
Well,
okay. Okay. Now, stupid is as stupid does. We've been to Germany a million times. It just never dawned on me because they always just sort of did that part by themselves, but they did not have traveler's insurance. So then I got to do the TRICARE Tango, which was exciting and not fun. But everything was covered. Like, it was the craziest thing. You had to prepay everything because it's a TRICARE situation and we were not actually stationed in Germany, right? So as retirees, it is covered, but it's not prepaid. So you have to actually collect everything. And then there's a process. There's an overseas emergency number that you call. They send you documents that you have to then substantiate everything. And basically you prepay and then they refund you everything.
So,
But-
I mean, in the States, that would be like tens of thousands of dollars or more. Like, was that what you had to pay up front?
No, and I was like, part of me was like, oh crap, and that's what she was worried about when she talked to me. She's like, we need to understand what your pay situation is, and blah, 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 blah. She's like, 'cause it's not an inexpensive thing. He's already had a number of different procedures, and I was like, well, he has insurance, but my understanding is that I have to prepay it. And she's like, okay,
Yeah.
well, we'll give you this. So what they did was, and I'll give you the number in a minute because after everything was said and done, I just kind of laughed, but. She's like, so we're going to send you the invoice and we can send it to the address that you're at here, or we can send it to you the address in the States. Typically it's going to take 15 days and then you have 15 days to pay. So you have 30 days to figure all that stuff out. I was like, oh, well, that's, super helpful.
Yeah.
But okay, whatever, what do you need from me? So, lots of signatures to give them permissions. Because basically that we had to say we were going to pay and how were we going to pay? So we took care of all of that, and then they sent me on my merry way, and I heard nothing about it again until I received the bill in the mail. So what did I say? 3 days. Yeah, it was 3 days. 3 days of being fully in the hospital, semi-private care, multiple X-rays, and then the endoscopy, all the drugs that he was on while he was there, because he was, they had him on pain meds, obviously, and then also all of his normal medications. They of course provided him all of that, some physio while he was there to figure out what they needed to do. But yeah, so that was 3 days with transport to the hospital and transport home from the hospital with medical services to do all that. So I never had to worry about, because he had broken ribs, he can't, he had to be flat while all that was happening. So the total bill for that, I don't have it in front of me, but the total bill for that was like 3,200 euros.
Oh my God. That's amazing.
But we just want to list the places because you may be thinking of traveling there, or or thought of living, or whatever the circumstances are. So the number one on the list was Germany, and we have mentioned that. And with Mona's story, she's also Germany, United Kingdom, so the UK, France. Paul, you're there, and certainly can attest to that. Here, Norway, Switzerland, Singapore, Japan, Denmark, and Costa Rica. So those are some places that offer universal health care.
And obviously there's different comfort level of treatments on that list.
Correct.
But
Correct.
Yeah, bottom line is the majority of Europe in the EU. I know Great Britain is not in the EU anymore, but everyone has some sort of healthcare that's basically
and you said that it goes from, because like it's one system, right? So you can take can you explain that? You have your card or whatever. And if you
anywhere I travel, this is why I say I don't understand why America can't do something like this or whatever. Everywhere else does it. You have your, obviously, because we're paying a shitload of money for taxes, which no one cares about because you get the coverage. You get your normal insurance card, which is your life basically here. And then you have another card that is your international EU insurance card. All that basically means if you're outside of the country that you're in, so for example, France, and I get hurt, God forbid, in another country, to include America, I will pay for it, obviously, get the receipt, and then I bring it back to my country, and then I submit the claim for it, and then I get a reimbursement. And it's well over 95% of your reimbursement back of whatever it is that they... now, it sounds great and stuff, but of course, there's always dilemmas. And I think, your friend too had touched on some of this stuff too as well. But
anytime that I needed to go to the doctor, even though we don't technically have insurance, so like that first appointment where my mom went to the doctor, they just did us as a private patient, which meant that you pay and then you get reimbursed, and they don't care that we don't get reimbursed. You just pay out of pocket. But like I said, it was like under $40 to see the doctor same day and get a prescription and fill the prescription. Like her antibiotics were like $5, and then. For my dad, even with pain medications, like he's like getting like high level narcotic pain med. The total pain meds that I had for him before we went to the main hospital after that, the total bill, and he had 3 different pain medications, was under $20.
Wow. Well, I mean, so that's our first tip. Make sure you carry an extra envelope or something where, if in case something happens, along with your important papers, you have an envelope to keep everything in so that you have your receipts. For sure.
Receipts are everything, and it must say paid. It must say paid.
Yeah. Paid. So it had to have that paid stamp on it.
Yes.
So now, word to the wise, which anytime you travel, get traveler's insurance. It just makes everything that much easier. In this case, I could slap myself because my parents were like, we have TRICARE.
Yeah.
I was like, okay. Okay. That's stupid is as stupid does. We've been to Germany a million times. It just never dawned on me because they always just sort of did that part by themselves, but they did not have traveler's insurance. So then I got to do the TRICARE Tango, which was exciting and not fun. But everything was covered. Like, it was the craziest thing. You had to prepay everything because it's a TRICARE situation, and we were not actually stationed in Germany, right? So as retirees, it is covered, but it's not prepaid. So you have to actually collect everything, and then there's a process. There's an overseas emergency number that you call. They send you documents that you have to then substantiate everything, and basically you prepay and then they refund you everything.
So, but, I mean, in the States, that would be like tens of thousands of dollars or more.
But it's the travel insurance, like you said, for folks, a lot of people, to include myself, ever, no one ever thinks about getting travel insurance.
Well, and there's two different types. So the travel insurance for like if your flight is delayed, you lose your bags, yada yada. But medical insurance is like an additional thing, and that is in case your insurance isn't going to cover you out of country. I mean, for the most part, I believe your insurance will cover you in every state, but maybe that's not the case. I don't know.
Yeah, I would double check. Always double check your policies.
But if you are like traveling to, I don't know, you could be in Uganda, and I mean, TRICARE, good Lord, that I don't know what type of navigation I'm going to have to go through to get TRICARE to cover me in Uganda insurance.
So in your case, Trecia, if you were to travel to a different country or something like this, one of the things, because we want to make sure people think about this, because this is something that's important, and I guess I didn't think about it that way, but we should always think about what we need to do if we get sick. So what is
there needs to be a plan, right?
Yeah, because I never planned.
So and I know that Forbes actually has a list of best travel insurance companies that you can use, and its travel insurance is not just, again, Benef, like you said, not just the traveling with your baggage and that sort of thing, but actual medical insurance. So there is a list. We'll have it in the comment section so that you guys can look through as well and see that article. But basically what it covers is meaning that there's an amount, if you will, a certain amount that's good for emergency coverage, right? So, in case something's, last minute or something happens, just that, an emergency, you fall downstairs, you fall down subway stairs, you do whatever the circumstances are, because this actually happened to my friend. She was traveling solo and she fell down a very long flight of subway stairs. What happens, right? Yeah. So there was an issue with that. Real-time travel care. So while you're actually on a trip, this is specifically just for that. So if you're tourist, or if you're touring or going on vacation, this would be for just that set of time. There's even those limits. And then also you want something that is also streamlined, or like there's a daily coverage, because they have that too, where if you have a specific situation or you have a delay in travel and you become sick, there's also riders for that. So you really have to look at it and see what you would need. I know it's not the sexy part of travel, but it's definitely something that you want to be aware of.
If you need to get medevac somewhere, that's super expensive, and it's like that's the insurance can cover you for that too.
Yeah. Absolutely. And it's so weird that you guys are saying all this, because like I said, I had to ride in an ambulance here in France and never got a bill.
Yeah.
So, and having an ambulance in the States, that's over thousands of dollars just for that.
Thank you.
Yeah.
Right. So TRICARE being that's military medical, correct? So this is different from your Aetna or your Blue Cross Blue Shield as a civilian, right? So, why we keep referring to TRICARE.
Right.
But that's what I have.
What I wanted to add onto your list, or what you mentioned about Ford, is that if you're doing travel insurance, I would highly also recommend, wherever you're traveling to, and this is obviously if it's one destination or a continent or something like that, is to look into their international insurance coverage. Expat, social media sites usually is a good source of information to be able to do that. So I would definitely,
like the State Department will usually have information on for each country as well.
Yeah,
for what's
I would not hang on Aetna and all those other stuff, because they might charge you an arm and a leg. Whereas it's easier to do coverage in the company for the country you're going to, because they will know how to handle whatever it is that you're needing.
Exactly. You mean just as a traveler or as a person?
Just as a traveler. No, just as a traveler. If you were traveling, for example, to France, take a international insurance within France, It's easy. There's usually a multitude of list of things or companies.
Wait, so you're saying, I just want to be clear, like I would go to that website and purchase a plan? Is that what you're saying?
So each one, so for example, if there's I don't know, if you Google in health insurance for travel to France, there'll be a list of companies that will pop up. And then you can obviously do your research and see what will fit you best and what coverage will fit you best. And you know, I'm not trying to put down my damn country because I fought for it. But the point I'm making is I'm a, you know, case, you know, based story of, you know, I keep hearing this notion about, you know, socialist healthcare and all this other stuff. And I just think it's just one of those fake talking points. And I really wanted to get it out there that we need to stop that because, you know, I've lived majority of my adult life.
Stop bashing socialism?
Yeah. Well, I hate the fact of even saying socialist healthcare. It's just freaking free healthcare, basically.
Everyone.
It's care. It's care. It's
care.
basic care that you should
you deserve as a human being.
You deserve it.
Yes, as a human.
Yeah.
And I hate when I want someone to really tell me, oh yeah, because the one thing they say, oh, you didn't have that great of a care, did you? No, I had the best of care. I went to a public hospital.
Right.
I went to a private hospital. Now I can admit the difference between a public and a private hospital, a lot, okay? I can admit to it.
Yeah.
But the care was good.
But the level of care was the
good.
same. The level of care,
I mean, I dislocated my shoulder and they took me to the nearest public hospital.
Oh, that was you need to repost those reels. Yeah, that was the one where it looked like you were in like a haunted. It was like
it looked like I was in a because they turned the lights off because of energy savings. Yeah. And you're just like, okay, why am I sitting in this dark hall?
Well, I will tell you that video. Seriously, you look like Nurse Ratchet was going to come out of somewhere and just
believe me.
It looked like a psych ward, honestly.
I was scared, but I was
the
just
amenities may not be the amenities that are extra may not be as great, but the care is still.
But the care, the level of care was there, which is the most.
This is the truth.
Yeah.
This is the truth. Is that I have to admit the nurses are a lot nicer in the States. The doctors are a lot nicer in the States. Whereas here, they will just tell you what is wrong, and that's it. They don't expect you to be like, oh, and they're gonna be like, oh, don't you worry. No, they're gonna just tell you.
So like the bedside manner is like,
no, there's no bedside manner.
Yeah.
But I guess, you know, really to our to the folks who are listening, you know, do you have any stories of, you know, your healthcare that you've received abroad? We'd love to hear those stories. We'd love for you to share that with us. And, you know,
and if you have any recommendations of any insurance companies that you guys may have used.
Absolutely.
Traveling.
Yep, absolutely. So drop your questions, your comments. We'd love to hear from you. Don't forget that, to check us out, our other episodes here on Rhythm and Rome with Benef, Paul, and Trecia here on YouTube.
Yeah.